You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. In fact, my first guest is probably the most experienced implant guy that I've interviewed in 20 years. He was on the show 20 years ago. He was doing dental implants then. He said 20 years ago, nobody should be wearing a loose-fitting denture. In studio, we have Dr. John Willardsen. Dr. Willardsen, welcome back to the program.
Thanks, Randy. Glad to be here today.
20 years ago.
Yeah.
You were doing implants back then. You were also teaching at Loma Linda back then, teaching implant dentistry.
That's right.
Now, for people that don't know your practice, like who's the typical implant patient these days that comes in?
I'd say there's two categories of patients. You've got the patient who maybe they've had the root canals and the crowns and maybe periodontal disease.
I got to interrupt for a second, but in your office, you say that people literally can walk in after maybe one appointment, but on the second appointment, if everything goes right, they could walk in without teeth and walk out with a brand new set of teeth.
Yeah,
Is that true?
Absolutely. So what we do is on that first appointment, we take the teeth out, put their new set of teeth in, and they walk out with a new smile.
How soon can they eat?
They can eat that day. Yeah, same day they can eat.
Now you've done, and people need to know, it's a real interview, and I'm trying not to endorse you, but I am endorsing you. I mean, you're one of the guys that can deliver the goods. I mean, I've known you for 20 years. We're not buddies, but I meet you every time in this studio.
Yeah.
But is there that big of a learning curve? I mean, you've done thousands and thousands and thousands of these.
Yeah.
Are you that much better now than you were even just 5 years ago?
Technically, absolutely, but more importantly, I'm better in the sense of I really appreciate now what this procedure does for patients, because I've heard the stories from every single patient who have struggled with loose teeth, failing teeth. They've spent who knows how many thousands of dollars on their mouth. Now it's all coming out and they need to, have something, and they want something permanent. They don't want a denture. Or the patient who is in a denture and can't stand the loose dentures anymore. So I think I've probably improved mostly in the sense of how much I appreciate this procedure and how much it changes people's lives, because it really does. I mean, it's a life-changing procedure. So Randy, what happens is, what takes a lot of guys 9 months or a year to complete a case, because I've done so many of these, I can streamline the process and get it finished in a couple of visits.
Is that
and,
right?
In that, it really does make such a big difference for patients because they get a smile immediately. They're able to go out socially and go out to dinner and, be able to, kiss their wife again or whatever it is, because they feel confident and they've got their smile back. And, it's something they haven't had for years and years. And so it really does make a big difference.
We were talking in the green room and you were telling me that there are people that have been watching you, like on television with interviews, variety of interviews. I know you've been on The Doctors, right? I mean, you've been on a lot of network shows.
Right.
But they've watched you for a long time, and it takes them like 10 years sometimes to finally do something about it.
Yeah, that's
really
funny you say that, because they do. They'll come in, they say, yeah, I've been watching you on TV for the last 6 years. And finally my wife pushed me to call, and drug me in here to get this taken care of. But yeah, I mean, everybody has their own time frame and they have their own motivation. But those same people who have waited 6-10 years or whatever lost that period of time. I know
That's a good point.
I know how much this procedure will change their life, and there's no need to wait. Don't wait 5-10 years or whatever. Just get it done, because and they could talk to any one of my patients and they would say, absolutely, this was a life-changing procedure, and it really is such an amazing thing, because you ask me, what's changed or how have my techniques changed? It's more just the appreciation and watching, transforming these patients' lives with it's not a simple procedure, because it is technically, it's pretty demanding. Obviously surgically it's demanding, and then the prosthetic side or the tooth fabrication side is demanding as well. So I have to link all those two things together to make sure that the outcome is perfect, which I do every single time. But that perfection translates into this patient's life that is now changed.
And you say your prices have come down over the years.
Yeah, that's true, Randy. Because I've streamlined this process, and fine-tuned it down to such a simple, not simple, but for me it's simple.
Okay.
And so I'm able to pass the savings along to the patient. Not to mention I'm able to, with the implant companies that I work with, I do a high volume of implants. So
you get discounts.
I get a different rate, I guess it's a discount, than somebody who does not place the high volume that I do of implants. So all of those things I'm able to pass along to the patient, and save them money ultimately.
Now, I know you brought a lot of photos, before and after photos. And I should also mention, I mean, you have, probably the most before and after, or at least one of the most I've ever seen. You have a lot of photos. You told me I have thousands of photos. I said, could you bring 8 to show on the show? I could bring thousands.
Well, I brought 16 just in case, But no, I do. It was a struggle, as I was going through my before and afters, trying to decide which one's the best for this setting. I literally had to go through a couple thousand photos just to, figure out which ones are best.
And they don't mind you using their photos, you say?
No, because they too appreciate the transformation that's occurred, and they're happy to show it off. And we ask them, are you okay if we show these pictures? And
now, what I like about you, and I said there may not be a place in the show, but you brought a picture of you and your wife on the show. You said, "Can I show the picture?" So
well, I do more than just teeth.
Okay.
I have a life outside of my practice, barely. I mean, it's a marginal amount of time.
Let's hear about you a little bit, I guess.
Well, I've got my family. I've got 4 kids and my beautiful wife, and my sons and I, and my daughter and my wife. We love to be outside and ride bikes, mountain bikes, go to the beach, and ride dirt bikes actually. So
well, that's nice.
Yeah, so we try to have a little bit of diversion, not keep it so serious all the time, so that so we can, because it is very stressful. I have to say, my practice, just managing these cases are very complex. The demands of each person is different, and so I have to meet those demands according to each patient. So I try to do things to try to keep my mind fresh and focused and content and have a good positive attitude.
And most of these people have some level of sedation. Is that right?
That's
during
the
procedure?
Absolutely. They are, I have an anesthesiologist who is part of my staff.
Oh, is that right? Okay.
Board certified anesthesiologist, a physician. I don't use a dentist or a CRNA, but so it's a dentist a physician who's managing the patient's anesthesia while I'm focusing on the surgery. I think that's very important. Some practices, the doctor is doing the anesthesia and the surgery, and it's just, I don't do that. I like to have an anesthesiologist manage it. And they wake up, they have new teeth, and they're good to go,
Now, we should also mention something about you, right? You've been a dentist since you were like about 7 years old, right? Almost.
Feels like it.
Because your dad's a dentist. You used to work, help out in the practice.
I did.
I think your sisters have married dentists, if I recall.
That's right.
Your brothers are all dentists, right? Except for one.
Yep.
So is this all you guys talk about also? I know you do motorcycling and things like that, but this is like in your blood.
Pretty much. My dad, he was a dentist, had a couple of practices and back in the olden days, and it's funny because that's kind of how I got so interested in implant dentistry. I used to work with him and watched him, and actually I worked with him as a resident when I was at Loma Linda, and I just would see the patchwork, the partials and the dentures, and I could see him over there with a patient grinding on a partial and just, kind of put it in the mouth and going, "Okay, Mrs. Jones, you're good to go." And I just, in my mind, I felt like there's something wrong here. There's got to be something more. And this is at a time, this is like mid-90s, I guess, at a time where implants were it was the beginning stages of implant dentistry. And of course, implants go back to the 60s, but it wasn't until the mid-80s, early 90s, mid-90s that they were in the hands of dentists, that were being part of the dental practice. And so in my gut, I just thought, there's got to be something more to this.
But isn't that like dentistry even today? It's patchwork. Fixing, crown on a cracked tooth and fixing this and fixing that. And like you taught me this. You say implants now, it's like getting your teeth back.
Absolutely. I don't, not to, I guess diss the industry right now, but implants solve that problem. The patient who's had a root canal and a post and a crown, and they've spent $5,000 on one tooth trying to save it, and now the tooth is coming out. Implants solve that problem. Or the denture wearer who's had who knows how many relines and sore spots and adjustments and this and that. Implants solve those problems. Or the patient who's losing their teeth and for fear of going to the dentist, for fear of, the infection it's infested their mouth now, and there's nothing they can do. They could brush all day long. It's not going to clear up the periodontal disease. At this point, for a lot of these cases that I'll show you, the only thing that's going to save their mouth is removing the teeth and getting that out of the mouth. And patients will ask me, so if you take the perio-involved teeth and get them out of the mouth, and then place implants. Is the infection going to come back and then reinfect the implants? It doesn't. Of course, they have to change their habits. Habits led them to losing their teeth, so they just need
they still have to keep their teeth clean.
Yeah, they need a little education on how to maintain it and what to do. And once they do, they're good to go. And they've had something that's affected them so much is now gone. It's not even an issue.
Yeah, but if you have bad gums, right?
Yeah.
The implants aren't more likely to fall out?
Absolutely not. No, because the teeth are now the cause of the infection. It's kind of like
so when you remove the teeth,
you remove the infection.
Okay.
It's like if you were to get a sliver in your finger. If you don't remove that sliver, a well of infection is going to form around the sliver until you get the sliver out. I mean, you can take antibiotics all day long. You can try to clean it, but until the cause is out of there, the infection is going to be there.
So it's kind of like the third set of teeth.
It is the third set of teeth, no doubt. I mean, once the teeth are out, implants are in, and the patient is maintaining it properly, and the prosthesis has been fabricated correctly, and it's not just a big lump of plastic in their mouth, the patient will no longer have issues with periodontal disease.
So you brought some photos. What are we looking at?
I did. So here we've got, I got a lot of photos, so I don't know how much time we have.
Okay, we'll try to fit them all in.
So here we've got a patient who, this guy is such an interesting case. He's actually a YouTube sensation. He sings on YouTube. The lady he sings with is actually in, I think, Taiwan, and he's here in the U.S., and they've created this YouTube channel together where they sing together. It's really a cool thing. But he did a lot of research. He went to some of the big box implant chains and had a consultation, was adamant about not having, he knew he wanted implants, and he was not about to wear a denture. He said that in our first consultation.
Okay.
I'm not going to a denture. The teeth had to come out. He would not show his smile. I'd ask him to smile, and he really was inhibiting his smile. And so I knew that a denture was not an option, and also the plastic denture that's attached to implants was not an option. So
that doesn't go over a lot of people's heads. In fact, something you taught me today in our green room is typically how it's done is they're giving them a big set of plastic teeth that snap in, snap out. And you said, I don't do those.
I do not do those. I don't do the snap in, snap out, nor do I do the ones that are attached to the implants permanently. That is still a big piece of plastic. And so he knew he wouldn't be able to sing with the denture or with what's called a hybrid, which is the plastic teeth on implants. So after doing my initial assessment, my CAT scan and diagnosing everything, we were able to put a really nice treatment plan together for this patient that essentially replaced every single tooth with an implant. And not everybody needs that. But in his case, in his situation, and in my practice, I custom tailor the treatment plans. So what did we do for him, Randy? He comes in the morning, we do the procedure, and he goes out with a new set of teeth that day.
How soon could he eat?
He was eating that night.
Are they a little nervous? Like saying, Doc, are you sure I can eat?
No, they're not. I mean, they trust that I used good judgment as the surgeon, and the implant stabilization was there, so we were able to load his case right away. So.
He looks pretty happy.
Yeah, very nice guy. Yeah, he's a YouTuber, and he knew this is what he needed, and he was willing to go the distance to get what he knew he needed.
So with all these patients, like, what are they afraid of most? Like, what do they tell you that they find out is just not true?
Yeah, so a lot of patients will have the fear of, am I even a candidate? How much pain is there afterwards? After what happens during the procedure? So these are all legitimate fears, but once we've gone through the process and it's completed, they realize that there was nothing to be afraid of. So here's a woman who was convinced that she had to have all of her teeth removed. And it's not uncommon out there where patients, they feel like they need their teeth out. And
they come to you and say, Doc, I want a brand new set of teeth.
I want a new set of teeth. How much is it going to cost to pull my teeth and put in implants? But, after looking carefully, she did not need to have all of her teeth removed. And not to mention, that would have been way more expensive to do that. So,
Okay.
So after doing my initial evaluation and x-rays and everything, we figured out that we didn't have to pull her teeth. We could do a lot of things to fix everything so that it's going to last her the rest of her life.
All right.
She really wanted me to keep the gap or the diastema
right in the front
right
teeth.
in the middle of her.
She liked it.
She liked it. She's like, "Can you keep the diastema?" I said, "Well, we can. We can do whatever you'd like." But after showing her some photos and an image of what it would look like with it closed, she's like, okay, I said, I think we should close this. It's going to look better, I promise you. She's like, okay, I'll trust you on this. Take a look at these before and after side by side.
Okay.
Look at the before.
Yeah.
And look at the after. Notice how she's a different person. She is kind of radiating in the after picture.
She looks definitely more, it looks younger in the after. I don't think anybody would disagree with that.
Notice the edge of the teeth, the incisal edge of the teeth is following her lower lip.
On the after.
On the after.
Okay.
That is by design, and that's part of aesthetics. That's part of making it look beautiful and making it look natural, like those are her teeth. And she now gets compliments all the time, like, wow, your teeth are so beautiful. So, it is by design that, we design every single case so that it's perfect for every patient that comes through the door.
And the other thing, and we talk about this, I mean, it's not all about beauty, but she looks more attractive in the after than the before. There's no doubt about it.
Right. Yeah.
And, it's like we have our discussions. I say, but Dr. Willardsen says it's just teeth. And you say, no, it's more than that.
No, absolutely. Well, Randy, back in the 60s, the cartoons, if you wanted to make a cartoon character look ignorant or not so smart, make buck teeth or gap teeth or a missing tooth. Yeah. Same thing applies here. I mean, for us too, if I were missing a front tooth, it'd be hard for me to go in and try to tell
to be
patients
taken seriously.
Taken seriously in what I do. And a lot of times patients don't get that. They don't realize the value and that teeth have.
Like in the movies. And I think we've talked about this.
Right.
If you want to make someone look poor, you give them bad teeth in the movies.
That's true.
Right.
Yep. So, teeth are very valuable. And until a person has had them restored, then they realize that. But it's hard to know that until you've gone through the process.
You say they start like not a new lease on life. I'm paraphrasing you, but they act differently. They dress differently. Like the hair club for men. They get the guy who gets a hair and his whole life changes.
Yeah, it's true. It is a new lease on life. It's the same thing. Once the hair's restored, they feel better. Once the teeth are restored, same thing. And so the confidence comes back, their ability to chew comes back. Maybe they're dating again, or it's just a matter of what they feel inside, and it radiates on the outside.
So what do they like more? That they could eat whatever they want, or the way it looks?
So I've had multiple cases. Patients come in who are like, I don't care how it looks. I want to be out of pain. I want to be able to eat again. It doesn't matter the aesthetics. I'm happy with the way my teeth are now, but I want to be able to eat. So, and luckily they get both. In this patient, we finished his case, and now he's taking selfies. He's posting on Instagram
pictures of himself.
Pictures of himself because he's happy with the way it looks, and so he doesn't have that inhibition anymore. Whereas before, he just wouldn't show his smile, so it didn't bother him. But now that he has his smile restored, he's able to smile again and feels good about it. Also, the opposite is true. I had a case the other day where the patient only wants her front teeth fixed because she's only concerned about the way it looks or the way she's smiling. And she's missing her molars, missing her back teeth, admits to me, I can't really chew anything, but I don't care. I eat applesauce, I eat soft things. But once we restore the case, now she's able to chew again, and she realizes how important that is, not to mention the fact that it looks beautiful.
Okay.
So she gets the benefit of both by going through the process.
So they can eat whatever they want?
Yes.
I mean,
absolutely.
Could they bite like a carrot with their front teeth, like
Yes.
raw?
Yes.
So it doesn't matter.
Broccoli, carrots, pizza, whatever. They can eat anything they want. So here's another patient who came to me that, oh boy. And he definitely, we had to take the teeth out. No matter what he does, whether he brushes or tries flossing, it's done. Those teeth have to come out. So with him, Randy, we removed the teeth, put the new set of teeth in one day. He walks out, and look at how young he is. He should not be in a denture. No one should be in a denture. But
he would have been wearing a denture.
He would have been absolutely wearing a denture. And so he has permanent teeth. The bottom is the zirconia prosthesis that is permanent and doesn't come out.
Now, how old can somebody be to do this? Like, what's your oldest patient that gets brand new teeth?
And I've said this on your show in the past. I think the oldest patient I have is 92 years old.
92.
Yeah.
But I still, even though you brought it up before on the show, I still haven't wrapped my mind around why would a 92-year-old want to go through this procedure? Is it really that important?
Why wouldn't he, Randy? In fact, this patient said, I don't care if I live 1 year. I want to be able to chew. I want to be able to eat again.
Okay.
And go through what? I mean, it's you go to sleep, you wake up, you have a new set of teeth, and you're eating pasta or eating steak again the next day. So there's really not much to go through other than just once you get it done, you're good to go. And he knew the value of having his teeth restored and being able to chew again.
So no more dentures.
No more dentures. Nope.
You know, in the old days, we used to say, my first guest is John Willardsen, the king of dental implants, because back 20 years ago, very few guys were doing this.
Yeah.
Right? You say, well, I'm not the king.
And how many interviews have you done now since 20 years ago?
Yeah. It's amazing. So,
Yeah.
I mean, you have story after story after story of. So you come from a perspective that, look, if you don't like your teeth, if you can't eat and chew, do something about it.
Absolutely. There's just no
And
reason.
don't settle for a denture.
There's no reason to wear a denture. There's no reason to be running around with teeth that are falling out or they're going to be coming out anyways. Get it fixed. Restore your smile and get that.
We have to mention this because we get emails about this. The problem with dental implants is even the best dental insurance doesn't cover it. Medicare, Medicaid doesn't cover it.
But patients are financing this. They are getting it done. Once they realize and understand the value, they go to whatever lengths they need to in order to get it done.
So you don't carry it, the financing, but you have lenders that what? Do dental procedures?
We have multiple lenders that will finance the patient and stretch it out over 5, 10 years, whatever it is. Make the payments so they're manageable for each patient individually.
So you have to have okay credit to get this done.
You do have to have decent credit,
Okay.
But we do finance these patients.
Like every day or just every once in a while?
Financing every day.
Every day.
Every day, yeah.
So now there's no more excuses.
There is no
You
excuses.
got sedation, so
Yep.
you don't have to worry about that.
That's right.
It's financed.
Yep. There's
Good.
no pain involved, and you just, you wake up, you have a new smile, new teeth, you're able to eat.
So you are the king of dental implants.
Well, I've done more implants than
most guys.
but I don't know that makes me the king.
Okay, we have time for a couple more. I'm going to rush you.
All right.
And I'll try not to interrupt.
So here's another patient. Guy comes in the morning, walks out with this, Randy. Take a look at that after. He's not quite used to smiling because he's been so limited with his smile for so many years. But you can see how that's transformed him. In fact, I saw him about a week ago, and he truly said, he's like, Doc, I got no problems. I have no concerns. I love it. I'm able to chew, eat, smile, and I'm just
He has better teeth than all of his friends, I bet.
Yeah, absolutely.
Time for a couple more.
Okay, here's another case.
Oh, my goodness.
A patient,
This has got to be completely unusual.
Randy, it's really not. The only reason is you don't see it. Why? Because they're not smiling. They're walking around just trying not to smile, not to show it, but you think they're grumpy or upset or whatever.
Or a tough guy.
Tough guy, yeah. And really, that's not. I mean, this is the nicest guy on the planet right here. And look at that after.
Oh, my goodness.
It's transformative.
Like a celebrity now.
He really is. And so, the nice thing about this case is his wife told me afterwards, that they hadn't kissed for a few years just because of the smell of the gum disease. And and now that this is all completed, that's not a problem anymore. So, yeah, it's an amazing procedures. So, Randy, here's a guy. He comes in. He's got bad teeth. Take a look at his smile. He's sunk in, and look at his mouth, and then take a look at the after.
Wow.
He's
And those are brand new teeth supported by dental implants.
Yes, absolutely. Brand new teeth supported by dental implants. Randy, take a look at the before and after side by side. He is much more sophisticated, handsome. He's ready to charge the world, go after the world.
He looks like a different guy.
Yeah,
it's
he
true.
does.
It changes your appearance.
No question about it. Yeah.
Even though I say it's just teeth.
Exactly.
I know you get mad at me when I say that.
Okay, take a look at this this last one here. And this patient, just the nicest lady who comes in. We had to remove teeth, and she wakes up. She gets a brand new set of teeth, top and bottom. But again, take a look at how happy she looks and she feels, and that's really
Was she another person like headed to dentures on that path?
Yes, absolutely, definitely headed into dentures.
Do they come in and say, because they've seen you on TV, do they say, I want teeth that don't come in and out? Or, I mean, what's their language? Like, what do they say?
What they say is they don't want dentures. That's what they say.
Is that what they say?
They do not want dentures like their grandma or like their mom or something. That is precisely what they say. They don't want dentures. So, like I said, they don't want dentures, but they don't know what that means to not have dentures. And they come to me for that specifically because they know that I know what needs to happen in order for them to not be like their grandma or their, or whoever they know that has had to wear a denture, struggle with a denture their entire life.
Now, people travel to see you, right?
Absolutely.
I mean, people drive hours and hours to see you.
Fly. I mean, I have patients fly from all over the place. All right, Randy, one more.
Okay.
And then we're out of here.
Make it fast.
Okay. So take a look at this guy. This is the before. Take a look at his smile. In fact, this is a funny story. So he works on a fishing boat, and his buddies that are on the boat with him, they called him a sheep's head. His nickname was sheep's head. A sheep's head is a fish that has really snaggled
bad teeth. Okay.
And so Google what a sheep's head looks like, and so it'll even give you more. It's pretty funny. But take a look at the after. Again, he looks more sophisticated. He's ready to go after the world, and he feels good about himself.
So this was the guy you had to remove the teeth and give him a brand new set of teeth.
So in this case, I was able to save the majority of the teeth, add a few implants here and there. Some places they'll just say, let's take out all the teeth, put in a new set of teeth on implants.
So you have a philosophy or philosophical difference with that approach.
Philosophically, I would rather them keep their teeth.
If you can.
If I can.
It's cheaper. It's cheaper that way.
It's cheaper. Aesthetically, it can look better. But when the patient needs implants, then that's what we do too.
Okay. Well, Dr. John, look, it's always a pleasure having the show. We're out of time.
Always a pleasure.
The time flew by for me. I don't know about you.
It did, yeah.
But if they want to get in touch with you, okay, what's the first step? What should they do?
So give us a call to set up a consultation so that we can kind of get the ball rolling.
Do they still get to see you on every consult?
Absolutely. They see me on every consult, and I do every procedure. So I do the surgery, I do the making of the teeth and everything.
Do they ever ask, are you sure I could do this? Are you sure I'm not too old? Do they ever say these kind of things?
They do, yeah. And of course we assess each case, but 99% of the time, they're candidates. They can do it.
Okay, good. All right. Dr. Willardsen, thanks for coming on the show.
Appreciate it, Randy. Thanks so much.
You've been watching the Wellness Hour, news that makes you healthier. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.